Hello everyone, my name is Samruddhi Randive. Today we are going to discuss about the topic of pharmacovigilance history. So basically we start from the what is the pharmacovigilance. So pharmacovigilance, it is the science and activity related to the detecting, assessment and prevention of the adverse effect on any other drug related to the any other event which is related to the drug. So the pharmacovigilance term, which is divided into two parts such as pharmacon and vigilance. So pharmacon is like a medicine or the drug, and vigilance is a watch or it is under observation to keep in watch to getting the desired effect. So then we let's discuss about the history of the pharmacovigilance. So history of the pharmacovigilance is uh, started from the 175 years ago on the Jan 29 1848, when a young girl from the north of the England died after the receiving the chloroform anesthetic before the revival of the infection of the tonsil. In the 1937, there were 107 deaths in USA because of use of sulfonamide elixirs containing the diethylene glycol as a solvent. This solvent was considered as because of the death, but the manufacturing companies were not aware about the toxicity at the time. Consistently, the Federal Food, Drug and Cosmetics Act was established in 1938. It was aim was to renovate the public health system. In the late 1950 and early 1960, use of the thalidomide in 46 countries by the pregnant woman. It was introduced in 1953 as a tranquilizer. In 1961, a big change of European pharmacovigilance happened. In fact, he observed the incidence of the congenital malfunctions of the babies had increased up to 20% in a human who had taken the thalidomide during the pregnancy. In USA, in 1962, the amendment the required the safety and efficacy data of the drugs before pre-marketing submission. In the 1964, the yellow card was the structures in UK. Yellow card is a specific form of the complying spontaneous report of the drug toxicity. In Europe, 1965, the disaster of thalidomide stimulated the development of the European legislation. In 1968, the WHO program, International Drug Monitoring, was introduced and 10 members participate in this program. Many studies observed the drug reaction were conducted between 1968 and 1982. In 1996, the global standards level clinical trials initiated in India. In 1997, India attached to the WHO Adverse Drug Reaction Monitoring Program. In 1998, initiation of the pharmacovigilance in India. In 2002, 67th National Pharmacovigilance Center was established in India. In 2005 to 5, India launched National Pharmacovigilance Program. In 2005, accomplished of the structure clinical trials in India. In 2009 to 10, pharmacovigilance program PVPI started in India. The drug that banned due to the pharmacovigilance at the India, first is atelepsis, atenolol, citramidine, glacyclovir, camacin, methyldopa, ranitidine and sulforamide. This is all about the history of the pharmacovigilance which is present in India. Thank you.